Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers. Today, cannabis. Professor Yasmin Hurd is the director of the Addiction Institute at the Icahn School of Medicine at Mount Sinai in New York. Professor Douglas Berman is director of Drug Enforcement Policy Center and professor at The Ohio State University's Moritz College of Law. They recently served on a blue ribbon panel on the public health and medical consequences of cannabis policy. They speak with Dr. Josh Sharfstein about what that panel found. Let's listen.
Professor Yasmin Hurd, Professor Douglas Berman, thank you so much for joining me today at Public Health on Call to talk about cannabis. How are you doing today?
Great. Thank you for having us.
Yes, thank you.
So I want to start with a question that's a little bit embarrassing for me to ask, but I just want to see whether you could tell me what's actually going on with cannabis policy in the United States. I've followed it here and there over the last few years, but not particularly recently. I know there have been some state policy changes, particularly. Can I start with you, Professor Berman, since you're the lawyer?
Absolutely. And it's a incredibly complicated story that I could go on and on about, but try to do it in short form. About 30 years ago, California became the first state to legalize what we generally call medical marijuana. And then a number of states followed that lead. And then about a little more than 10 years ago, Colorado and Washington became the first states to legalize what we often call recreational or adult use marijuana, and a number of states followed in their wake. So there's now currently about 38 states that have legalized what we call medical marijuana, 24 states that have legalized adult use marijuana access. But during that whole period, there's been prohibition under federal law, though I should be specific about THC products. Looking back to 2018, federal law did update in one significant, though very complicating way by legalizing what are often known as CBD products or hemp products. And so we've got an even more complicated legal landscape where we have understanding some parts of the cannabis plant legal in some states, illegal at the federal level, other hemp plants that are legal nationwide but create some of the same sets of concerns. And so I sometimes joke, it's good for us lawyers. It's not clear it's good for anybody else.
Yes, it certainly is good for lawyers. It seems a little hazy, the legal picture, with all these different considerations. I'm curious about the medical and public health picture. Professor Hurd, could you talk to me a little bit about what some of the key issues are?
The same complexities also are here when you think about the medical and public health issues with cannabis. And for example, physicians and care providers who are bombarded with, oh, cannabis can help. I hear cannabis can help cure 20 billion different disorders. But there's no data to help guide the physicians because of the fact that cannabis is still illegal federally, the THC products. That means that little research has been done, and therefore very few physicians and care providers know really what to prescribe their patients, the dosages to give, and even the products that they should recommend, because there are also a complicated barrage of a cornucopia of many products out there, which makes even the medical landscape also very complicated.
What about public health challenges related to cannabis? I completely hear you. In the doctor-nurse-patient relationship, you got all kinds of challenges. But what about broader than that?
That's the whole issue in terms of, in order to protect the public, we need to understand what this drug and these products may have, their impact. And there's very little data on the public health implications of the cannabis policies that had been created, over the past 30 years. So there's very little research on the public health aspects as well.
And I'll add that as we've seen all this legal reform, there is clear data that cannabis use is going up. But even that data is quite opaque because people will report that they're using cannabis in various products, but we can't even be sure. Are they talking about a CBD product that they could pick up legally, from a local grocery store? Are they talking about THC products that they're getting from a dispensary? And then what potency, the concentration of the drugs, in every drug setting, that matters for health purposes, but we don't have a lot of good data on that. And that's, among the ongoing challenges to do effective public health analysis is just having the basic data, and that's largely lacking.
Now, you both served on a panel convened by the National Academies of Science, Engineering, and Medicine to get at some of these issues. Professor Berman, can you tell me a little bit about how the panel process worked?
Yeah, it was a fascinating experience. I was the only lawyer on the panel, which was quite exciting to be surrounded by a number of doctors and public health researchers and other experts in other fields, because one of the things that I've done as a lawyer is try to be humble about, I don't understand the medical science. I don't understand what do we have good data on, what don't we have good data on. And so the goal was to collect all these folks to be able to kind of highlight the range of just challenges and issues that have been confronted by all this legal change without a lot of data certainty or public health knowledge. And among the things that I both went into the conversation saying, I know this is really complicated from a legal perspective and must create all these public health uncertainties, but all these experts just reinforced again for me how many questions there are. And that involved, among other things, not just what products are people using and how could that impact things, but of course, we have a range of different users, right? Whether we're talking adolescents versus adults versus senior citizens, people who are pregnant, all of those may create different sorts of public health issues and regulatory issues that, again, I had a sense of, but it was just this rich opportunity to have all these experts talking about what do we know, what don't we know, and how can we make recommendations to do better in the public health space.
So you've got a great group of people. You've got some really important questions. How long did it take to study this and make some recommendations, Professor Hurd?
I think it took us, we were asked actually to make this go very quickly. I'm trying to remember, I think it's at least 6 months where we met as a committee in person. We also brought in people from the different sectors that are impacted by these public health questions, and including families affected by this, individuals who are workers who were testing, their employers tested them for cannabis, and the implications for that, people who were part of, impacted by the criminal justice system. We had open and closed sessions. And so in about 6 months to get everybody together, try to learn as much as possible, and then try to, make these recommendations in really understanding the regulatory framework of the cannabis industry. We were also asked to have a lens on the social and health equity aspects of the cannabis policies that are out there, because that's one thing as well. I mean, a number of these policies, and Doug can speak a lot to this, in terms of arrests were made on, Black and brown people in large part, and many people who voted for the legalization of cannabis, they voted to also improve the social injustice. But ironically, some of the data from our report showed that there may still be this racial inequities for example, people getting arrested, even though indeed the laws had decreased in arrests over time, but not for certain groups.
So let's start to talk about those findings. That's a very interesting preview. That the report is called Cannabis Policy Impacts Public Health and Health Equity. So you went through this process. You called it quick, but 6 months is a fair amount of time to study something with all these, different components. And you reached some conclusions about the ways that cannabis policy matters. And I'd like to ask you to talk about some of the major findings. I'll tell you that the report is online for free, and we'll link to it in our show notes. But for you both, what were some of the really critical lessons? Professor Berman, I'll start with you.
Absolutely. And I think the piece that I always had a sense of, but that became reinforced as we were doing the work, is that the federal government's sort of failure to thoughtfully kind of update its work on cannabis at the time that all these states were making these changes really wasn't good for either public health or health equity or even sort of the broader policy landscape, however you come at it, in part because you end up having a whole bunch of distortions that kind of drive the system when you have federal prohibition. The medical marijuana story is the best example, where because traditional doctors can't make traditional prescriptions because of federal prohibition, you get this recommendation approach that ends up to some degree dividing the medical community. There'll be a handful of doctors that will provide these recommendations, and then other doctors, as Dr. Hurd highlighted, that won't even get educated on these issues because they know it's federally prohibited and they're concerned about whether this is legitimate medicine. We also see this with other aspects of how states are trying to regulate advertising or just product safety issues. It's very hard to do that at the state level without any federal government input. And so a big part of our recommendations across a number of dimensions was, hey, federal government, it's time to start using your various tools that regulate other products, especially things like tobacco and alcohol, and bring that to bear here on cannabis. In part because I think the states want to be better on public health, but they don't have the tools to do so effectively, both because of federal prohibition and because there's just always resource and other challenges that impact how state policy moves forward.
So one big recommendation is for the federal government to kind of get off the sidelines on this issue because it has advanced so much in the last several decades. Professor Hurd, what did you consider a really significant finding in this report?
For me, some of the findings that perhaps some of the I already knew from my lens as a researcher studying cannabis, especially the developmental effects of cannabis, is that cannabis use now is more prevalent and frequent than ever before. The daily and near daily use of cannabis now exceeds that of alcohol. And I think that people need to understand, just think about that. Also, it's not just the fact that they're increasing their frequency of the use, but the THC, the delta 9 THC concentrations are increasing so much that, and as Professor Berman mentioned, you have all of these products that are out there now, and it's these high THC products. You also have, because of the